to increase understanding of major public policy issues, influence public policy through education and advocacy, and do take stands on issues after studying consensus. If there's anyone here who has not yet had an opportunity to join the League, we have a little table over there with membership brochures. And I have some announcements. You should all be stickered. This is our 20th anniversary year, so we're sticker crazy, but we do want to acknowledge it. At the forums, we had birthday cakes. None of that today, sorry.
We've got cookies.
Yes, we got cookies out. Are any of our original founding mothers of the League here today?
Well, Marge, I want that explained. No, I'm not that old, but I was a member when they became a local league rather than a unit in large. And so was Joyce Harrell, and so was
Sally Bryan.
Nancy White.
Sally Bryan.
Yeah, Sally Bryan, probably.
Okay, Marge, you're representing them all. Thank you. As I call your group name, please stand. If you worked at one of our recent voter forums, please stand. Come on, there are more than a couple of you. Come on. You worked at a voter forum. You registered votes. Keep standing. Keep standing. If you registered voters, and if on election day you stickered people to say thank you for voting. Now, the new members who've joined in the last 2 months, please stand also.
Nancy did all of
We have a special thank you for Marge and Steve Bowman standing over there for their extra special efforts with the stickering on election day and for the forums. Thank you, Steve. We would like to thank Tom Munsey, who tapes our general meetings and makes sure they're posted on YouTube. And I would now like to introduce Sarah Crosby, our program chair, who will help introduce the program this afternoon.
I join Diane in thanking everybody for being here, and we are delighted to be co-sponsoring this meeting with the Prevention Coalition, and we hope to learn a great deal today. Before we get started, I just have a couple of quick announcements for League members. The first is a reminder of our December 8th holiday luncheon, which will take place at Vinnie's from 11:30 to 1:30 p.m. There will be a silent auction, a luncheon, and a talk by our very own Diane Martindale, which is entitled Out of the Drawing Room into the Intersection of Art and Women's Rights. We're very excited about her talk, and we think you would all be interested in it. The price for the luncheon is $28 to members, $30 for those who are not yet members. If you would like to attend, you should contact Claire Kelm, who is sitting here, our membership chair, by phone, 378-3373, and she can give you the address to which you could send your check. We're hoping to have a good turnout, and we have some very special items available for the silent auction, so please consider joining us. Also for League members, the January meeting, the membership meeting will take place on January 12th, and that is our annual program planning meeting, both for the local league and also for the state league of women voters. So if you want to have some input about what issues the league takes up, both here at the local level and at the state level, you might want to attend our January meeting, which will be at the San Juan Island Library from noon to 2. For league members who have access to our state publication, Program and Planning, you might want to refer to that to see what the league positions are on the issues you want to take up. Now, as for today's meeting, we are co-sponsoring with the Prevention Coalition. I want to make an apology up front to anybody who has come here today with the impression that we are going to be discussing I-502. which was the legalization of marijuana in this state. We are going to be using marijuana as a tool in showing league members and all of you who are unfamiliar with how the Prevention Coalition works. Marijuana will be used as a tool in the discussions today. But if you are interested in discussing the ramifications of the passage of I-502 and its influence on our community, I have been told, but have no details of, a meeting that is potentially planned for the Grange on November 25th. So you might want to check the online calendars or with any of your sources in the event that you want to, shall we say, get down into the weeds of that discussion. Would you like that? And as for today's meeting, I would like to turn this meeting over to the coordinator for the Prevention Coalition, Cynthia Stark-Wickman. She's been the executive coordinator of the Prevention Coalition since 2006. She also serves as the San Juan County Prevention Coordinator, which position she has held since 2011. She also holds various positions in other community organizations, including the coordinator on the Coordinating Council for Leadership San Juans. Cynthia and her husband Gunnar came to us from the state of Hawaii, where they spent 30 years raising their family and educating many island children. So we're very lucky to have her here, and thank you for co-sponsoring with us, and I'd like to turn the meeting over to you.
It's my pleasure. So, of course, the greatest blessing and wonderfulness that is in the room right now is the many new faces, voices, and minds that are here today with our coalition members. And really, when Joyce had the idea and Sarah and Ann and Joyce started meeting, in my mind, the most important thing is the building relationship. So those of you who are here for the first time and may know nothing about the coalition, we may have coalition members who don't know anything about the league. It's about the new relationships that we're building. And my hope as the coordinator of the coalition is that some of you will have interest in supporting the work that we do as you better understand the work that we do. So with that in mind, with the most important thing being people who came together to create the coalition in 2002, is for us to quickly introduce each other. So I'm going to turn it over to our wonderful chair of the coalition, Brad Fincher, and it's kind of a tradition that we have. We're not going to make it as grueling as we sometimes make it, where we make people do a little think and share out before they introduce themselves. So thank you, Brad.
Hello everybody, and thank you for coming today. My name is Brad Fincher. Can I get everybody to say hi, Brad?
Hi, Brad.
Make sure you're all awake. Logistics, just because we got a lot of people in a small area. If you've never been to the Presbyterian Church before, the bathrooms are in the hallway on the back side of the kitchen. So you can either go around the back way or through the kitchen to get to where the bathrooms are. I do want to thank Dr. Joe Bettridge for once again allowing us the facilities of the Presbyterian Church to be able to host these functions and have use of the kitchen. So thank you for that. There's lots of food and nobody likes leftovers, so eat as much as you want. Go back for seconds. Don't be embarrassed about that. We also have a coffee pot that's inside the kitchen, and we can make pot after pot after pot. So if there's coffee that's empty or hot water that's empty, let somebody know. We'll just make more. Okay? Okay, Brett. Introductions. We're going to do that rather quickly today because we got a whole lot of stuff to do. So what I want everybody to do is one at a time. If you can stand up, that would be great. If you can't stand up, just be very loud. Like you to say your name and your organization. Anything else you want to say, keep it to about 10 seconds. What your job is or what you do and that type of thing. Because I like to be very concise and orderly, we're going to start at this table. We're going to go table to table all the way around, and then we're going to finish back up here for our next thing.
And if coalition members could identify themselves as a coalition, whether you're a board or executive board member.
Y'all got that? Because
So
we've
we're
done that
clear.
before.
Yeah.
Right.
Thank
Okay, so let's start with Diane.
Diane Martindale, League of Women Voters.
Ruth Fleming, League of Women Voters.
Ruth Fleming, League of Women Voters.
Sarah Crosby, League of Women Voters.
Susan Dellendorf, League of Women Voters.
Allison Longley, and I've discovered something I'm not a member of.
Yay.
Steve Bowman, League of Women Voters.
I like the voices of this first table. Everybody step up.
Pat Curtis, League of Women Voters.
Doris Van Allen, League of Women Voters.
David Dellendorf, League of Women Voters.
Tim White, Islander.
Boyd Pratt, both Prevention Coalition and League of Women Voters, and I'm also recording secretary.
Lovell Pratt.
That's it. League of Women.
Yeah, all the above.
Gordon Health Prevention Coalition, Vice Chair.
Rick Thompson, Prevention Coalition in San Juan School District.
Joe Bettridge, the Prevention Coalition and pastor of Friday Harbor Presbyterian Church.
Michael Garrett, manager of Thomas Health, Prevention Coalition treasurer.
Mary Lou Sternitsky, interested citizen.
Peter DiLorenzi, Service Officer for the American Legion.
Lynette Roberts, just a community member.
Lee Sturtevant, League of Women Voters.
Judy Moran, here to see what's going on. Victoria Compton, San Juan County Economic Development Council.
Jennifer Armstrong, the Prevention Coalition and the Family Resource Center.
Kathy Hagan, Prevention Coalition, Public Health and Compass Health.
Emma Scanlon, San Juan County Prosecutor's Office.
Doug Rowan, interested in ND.
Liz Rowan, League of Women Voters. Sam Lee, Board of Trustees, Prevention Coalition, Right-of-Way Driving School.
Debbie Fincher, along with Brad here, Prevention Coalition. We have a Facebook page if you want to find out more about us, and we also have a website. It's our initials for San Juan Island Prevention Coalition.org. There's my commercial.
Ann Jarrell with League of Women Voters, and I want to take a second to say, to let all the coalition people know, as well as the league people, remind them that this meeting is because our group, the League of Women Voters, have a program planning meeting once a year. And the reason we're here is because at that program planning meeting, we said we were concerned about drug use in this county. That's the reason and the origin of this meeting.
Lainey Volk, San Juan Island EMS, Injury Prevention Coordinator, and I'm part of the Prevention Coalition.
Katie Wilmerding, League of Women Voters, LSJI, Leadership San Juan, where I met Cynthia, and parent, almost surviving two teenagers. So, I'm really glad we're here.
Nancy White, League of Women Voters.
I'm Megan Gable, I'm the Prevention Intervention Specialist. I work at the schools, and I'm with the Prevention Coalition.
Marge Stanley, League of Women Voters.
Beverly Zapalai, League of Women Voters.
Nancy Best, League of Women Voters. Lopez.
Claire Kelm, League of Women Voters.
Marty Hewlett, League of Women Voters.
Louise Duster, League of Women Voters.
Joyce Sobel, League of Women Voters, and San Juan Island Prevention Coalition.
Mark Tompkins, San Juan County Health Department and Prevention Coalition.
Did I miss anybody? Got the video camera didn't say your name.
I'm the manager of Channel 19, Public Access Television on the cable. Tom Muncie.
Thanks. Everybody, once again, thank you for being here. It's always pretty cool when you have a whole lot of people in the same room that have concerns and opinions, and we'll be able to get to all those. I would like to say also, on your table, there are orange folders, and so there's going to be information, and we may be referring to those at some point, so each one can get one of those. I also would like to show that for introductions, we were supposed to start at 12:10, and it's 12:09 right now. So in our history, to be this early so far on is pretty awesome. I am going to turn it back over to Cynthia now to do a brief overview of what the San Juan Island Prevention Coalition is about.
But because you have such a well-projecting voice, I'm going to ask you to read the mission. It's a tradition that we always revisit the mission of our coalition to keep us grounded in why we are here and why we are committed to do the work that we're doing.
The Prevention Coalition mission. The mission of the San Juan Island Prevention Coalition is to reduce substance abuse by youth and to create a community culture supporting healthy choices and responsible behaviors in youth and adults.
Thank you, Brooke. I think I might need a volunteer clicker for me. So once again, thank you for being here today. On your tables in the center, there are white cards. If you have a question or a thought that you want to capture, I will come around the room during the presentations and collect those. So hopefully we can gather that. We're also going to have a question-answer period at the end. So that will be the time. So hold on to that thought and put it in your table. As Brad mentioned, we always put together a packet of some things for the take-home, and we offer you may take everything, or if it's something that you're not going to use, we ask that you leave it and we recycle the information at other meetings. So just a quick go through is the agenda. And we always have our calendar as part of our agenda, so at some time if you look through that, you can see the various activities that are traditional throughout the year in coalition work. The blue sheet of paper was my best shot of putting our 150-page strategic plan on one page. So basically, if this is the only thing you walk away with and someone asked you what's the Prevention Coalition, I'm hoping this would be able to answer the question. Today we're going to give you more details that can help fill in the blanks, or you may know these are the people you can come to talk about. The second piece of paper in your behind the blue sheet is once again out of that 150-page document to get our funding from the State Department of Health, which comes from the federal government, is our goals, objectives, and activities we do. And so this is a one-pager that helps us to stay focused. The pink sheets of paper, you will hear a little bit about this when I start giving you the overview. Joyce suggested giving you a visual on this because prevention work for the last 30 years or more has been grounded in significant research for community change. And you'll hear us talking about what we're attempting to do is, as we identify local conditions in our community that are root causes for substance abuse among our youth, what are the risk factors that involve our youth? And we look at the individual youths, we look at their families, we look at their school environment, and we look at the community environment as a whole. So we look at the risk factors in all domains, and we attempt to counter those risk factors to build healthy behaviors and healthy communities by having protective factors. So these two sheets, again, are a very brief infographic of 30 years of prevention research that now can be called science because they've worked at it and have researched for the last 25 years. Also in your packet, and we're not going to be going over that today, but for those of you who would like to take it away, every 2 years, the state of Washington participates in the Healthy Youth Survey, of which you will hear more about. San Juan County is able to, because of our numbers as a county, print out these fact sheets. So I have given you specific fact sheets for alcohol use in grades 6, 8, 10, and 12 for the county, for marijuana use, and for tobacco use. And then you also have school risk factor and school protective factors. On the info sheets, it does give you a little bit more definition about risk and protective factors that we're looking at. And then I believe you have, Boyd will be doing a little bit of PowerPoint, and this is kind of the little precursor that we used as more detail into our youth marijuana use data and how we're connecting our work to the environmental impact of Initiative 502. So that's kind of some of the connecting pieces. I did not make a PowerPoint for the overview because we're going to be using these little keypads as part of our dialogue and work today, and I didn't want to give you the answers to some of the perception questions that I'm going to ask you. And we probably will not use all of the slides. So I'm going to be my own little clicker here.
I'll be happy to do that.
Would you help me be a clicker? Yeah, it can be any key, I think.
Okay.
So again, the purpose of our gathering is for us to meet each other and for you to learn about what is the work of the coalition. And we will continue to emphasize that we came together to reduce and prevent substance abuse among youth. And we're looking at alcohol, tobacco, marijuana, and other drugs. A big part of that, which we're required to do to get any funding, is we have to be data-driven. So the data comes from the Healthy Youth Survey, which we have been engaged in doing every 2 years since 2002. So when Court and Boyd talk to you a little later on, you'll be able to see what the trends were. Thank you. So the coalition was founded in about 2002 for a very profound reason. Young people were dying as a result of impaired driving from alcohol, whether it was the operator of the vehicle in their own crash and fatality, or an inebriated driver who hit a pedestrian, and that pedestrian actually on a bicycle was killed. So people came together and said, we have a problem, what can we do? And this one you have to hit several times. I took this particular slide out of a state slide, and I didn't realize it was one of those where they do one little thing. So what the group of people who were founders learned was that there was a resource of funding from the federal government through the Office of National Drug Control Policy and Substance Abuse and Mental Health Administration to be involved in what's called the Drug-Free Community Support Program. The great thing about that support system was you had to commit up front to at least 12 different areas of the community coming together. So I'm going to ask the coalition members to please stand up again because I need you to be part of the pictograph, and then I'm going to include Mark and Joyce in that. So for example, Court Bell involved as an educator, Rick Thompson representing the school district, Joe representing church, Michael Baird representing Compass Health, which is chemical dependency. We now have our prevention intervention specialist also representing the school. Jennifer in the back representing a youth and family nonprofit organization serving the community. Kathy Hagan in the back, she was a representative of Parent Spring Street School. Sam, business. Debbie, I'm going to say parent. Lainey, EMS. support system, Joyce Family Resource Center, now Early Childhood, Early Learning Consortium, and Mark, Health Department, Brad from, I'm going to say District Court Law Enforcement. So those are, thank you. Boyd, I didn't mention you. You came on as a citizen.
Yeah.
Just a plain old citizen, too.
Joe Public.
So there had to be the commitment. So they actually had to sign and say, I agree to come together for the purpose of a prevention coalition, meaning that we are going to represent our organizations. Our organizations are going to keep doing what they do, but we're going to make some decisions of how to work together, use all of our strengths, and make a commitment to prevent and reduce underage substance abuse. So this is a state-created diagram. I think there's one more hit on that. So when you look at what's a coalition, all those dots, like you could become a dog. So we're always going to be growing. So I really love the notion of a circle of influence. So we as an individual, we have our circle of influence. Every child has their circle of influence. That can be family, school, out-of-school support systems, community, and then we go county, state, national, international type of thing. So that's how this all starts. We're always growing. We are very liquid, and the more dots and work and how we come together, the more powerful we become as a coalition. Every meeting is different. We're excited that at this time in 2006, we were excited to have 10 people show up. And typically, we're looking at 25 to 30 people each meeting now, and at least 2 to 5 new people who are interested in the work that we do. So you get to hold on to your autonomy in your work, but you've made the commitment to work to reduce substance abuse among youth. Thank you, Mr. Clicker. So our support system, big picture, is the Substance Abuse Mental Health Services Administration. Their funding and support for drug-free communities was with the Office of National Drug Control Policy, and we were very fortunate to receive 10 years of funding starting in 2003, and that 10 years of funding just ended this past September. Once again, we've been very lucky that we now still are receiving Substance Abuse Mental Health Services administrative money through the state of Washington's Division of Behavioral Health and Recovery, through the Health Department, to continue to do the work that we're doing. About 4 years ago, the state of Washington decided they had to do a redesign of how they were using the prevention money. In order for our state to receive treatment money from Substance Abuse Mental Health Services Administration, we must spend a certain amount of the money they give us on prevention. So for about $350,000 for treatment, we have been getting $30,000. It's about a 10% that we get. Fortunately, the state was able to get a supplemental grant, and we will have some funding to keep us going for the next 4 years. Over the 10-year period, part of the package from drug-free communities from the federal government was a support system through the Community Anti-Drug Coalitions of America, who has been really our primary trainer and technical support group. I would say it's been invaluable to me, even though I had 30 years of education training, community development training, staying on the forefront of coalition work and prevention work, and having the opportunity to meet with people throughout the nation and now the world has been invaluable. So we are required to use the strategic prevention framework model. I call it a continuous improvement cycle. We're always looking at our data, making our plans from the data, and implementing the actions, and then evaluating, is that making a difference? Did that affect our data? So we're constantly looking at ourselves and saying, what should we stop doing? What do we need to fix and do better? What are we going to do new? I'm one of those kind of people that say, if we're going to do something new, and we've got a full plate, we really need to look at that plate and say, what goes off the plate? Because we only have so many resources in people and money. Thank you. So the state has taken that flower and they've made it into the arrow going around, and so you'll be seeing more of that if you stay interested in us. It's just another way of looking at that continuous improvement cycle model. You can go ahead, I think I've covered that. So one thing I want to touch on lightly, and it relates to our logo. You'll see we have a yellow triangle, the island in the background. You've got it on your agenda up in the corner there. And then there's a circle of people going around it. And this was a youth-generated idea. And that yellow triangle comes in there from the youth in their curriculum for health. What they learn is the triangle of health: physical, emotional, social-emotional, and behavioral health. So throughout their health curriculum, starting in elementary school, there is awareness of building to be healthy as a whole. It's not just about physical, but there's also your mental, behavioral, and social-emotional health. And over time, the Division of Health and Social Services, now we have the Division of Behavioral Health and Recovery. And you'll be hearing more and more about mental health now that there has been the Parity Act legislation and insurance is covering mental health support and services equally to physical health. That it's finally being recognized as something that should not be a stigma and kept to the side. Also, that triangle for me means change. Kind of a scientific geek. Delta, fire, delta means change, or delta could mean looking at something and it's an opportunity to make a change. It's not a bad thing, but we need to make the change. And then the final triangle is the public health model, in that we have the individual who is in an environment and they are affected by an agent. And in our case, the agent that we are always looking at is the substance. So it could be the youth as the individual, the agent is alcohol, and the environment is San Juan Island, San Juan County. I've covered all of these, pretty much the support systems on a national and state level. However, Megan, our new prevention intervention specialist, has been with us now for 1 year. This is her second year of a 5-year cycle, and she is supported through the Northwest Education Service District to be a full-time employee in partnership with the school district. And this is something we have always wanted, and it's been a great benefit to us. Okay, how are you doing? Okay, risk and protective factors we already talked about, trying to balance them. If the risk factors are heavy on one side, we're still looking at how can we reduce risk factors by increasing protective factors. Now we're going to play. So we're going to practice using what's called the audience response system. So the purpose of this is that we can have some dialogue around perceptions and reality. So we're going to do a few questions. So everybody get one of these, and I'm going to tell you, once you press the button, you only get to answer once. You can't change your mind. Okay, and we do have extra up front if you didn't use all of them. So we're going to do a little demographic. I've tested all of these yesterday, so we have extra.
If you need one, raise your hand, please. We've got some more coming around. We would like everybody to have one, so let's...
How many of you have participated in using audience response systems?
I've already raised my hand.
Okay, so this is a great way for people to maintain anonymity and for us to quickly see what's the group feeling, because sometimes you can have a full room like this and 99% agree and one person has a different view but a strong voice. This system, which we do share with community organizations, is the opportunity to ask questions and get a view of what the room thinks. So does everybody have one in hand? So the first question we're going to ask is, how are you today as a participant? Even though we did that as an introduction. So you'll press the 1A button if you're just a league member, 2 if you're just a coalition member, 3 if you're both, and 4 if you're neither.
Do we have to turn these on?
No, they're already ready to roar.
Where's the receptor, though?
The receiver is on my computer.
So you want to kind of push it towards that way.
If we press it twice, it's not going to count the second time.
No.
So we can press it as many times.
You can press it as many times as you want. So
Why would you want to?
So right now I see we have 40 responses. And
so everybody, we probably have about 48, 49, 50 people here today, and we've calculated 40 responses so far. So my guess is probably somebody in the back, you may need to hold it up a little bit.
Or just press it firmly.
Just press it
A green flash. Right there.
Yeah. So everybody hit your answer one more time and make sure you press it firmly. It should pick up all the way to the back of the room. Did it change?
We got 43.
Okay.
Okay.
So that's our first experimental question. And then what happens is we get to see what's the breakdown of the room.
Kicking.
Cool, right? The kids love this in the classrooms. Okay, so another demographic question, and I'm putting it San Juan County with the notion that there may be people not just San Juan Island residents. So how long have you lived here in San Juan County? And you have 7 options on that.
What number do you press?
So you use the button 1, 2, 3, 4, 5, 6, or 7. Okay, everybody press your answer one more time.
One more.
See if it changes. Okay, now we got 44. Okay, here we go.
We still have some shy individuals.
Okay, so this is just another way of looking at it, and we could say our largest group is...
Could you
it
tell
doesn't
us
show
that?
for me. Wait. Okay, so 10 to 19 years is our largest group, and 20 to 30 years at 25%. So we've got 55% of the kids, or sorry, I'm thinking.
You can refer to us as kids.
My teacher brain is so on. It's thinking, oh, if I was with kids right now, I would have them add the 2 largest categories together. And I have to turn that little part on. Okay, now we're going to get into the meat of today. And this is our way of just getting some perspective of the people who are in the room today. So this is just your personal feeling. I feel that substance abuse is a problem in San Juan County.
For children or for everybody?
This is general.
General.
I feel that substance abuse is a problem in San Juan County. Yes, David?
There's different ways of determining that. One would be that you really know, you're involved in the school or churches or something, and you know it. Or another way is just anecdotally. And which way, does it
So I'm just saying,
What's your button?
says I feel. How do you feel right now?
How I feel.
How do you feel? Yeah, and this is the only one you can have no opinion. If you're not feeling it, you can say no opinion, which is always of interest to us, that people don't have an opinion in either way. Okay, everybody press your button one more time. It looks like we're coming out at 44, 45.
There's 45.
Okay. Any predictions? Classroom teachers, I'm doing. Any predictions? 1.5. What do you say, Dave?
2.
You think that the highest rate's going to be on agree? What percentage would you give it? 50. 55. 55, okay, here we go. Okay, so I'm happy to see strongly agree at 47% and agree at 38%. So we can say 85% of people in the room right now are in agreement that substance abuse is the problem.
Could you read the two on the bottom right?
On the bottom right, okay, it's 7% for disagree, 0 for strongly disagree, and 9% no opinion. So 9 times 45, so you got about 4 or 5 people that didn't have an opinion on that. So I'm not going to give you that option any further. I'm going to use the Likert scale. So now we're going to talk about youth, because that's what the coalition is focused on. Substance abuse among youth is a problem in San Juan County.
This is through the 12th grade, is that what you?
Youth is through age 21.
21, okay.
Cynthia, did you just say the problem, that it is a problem, or
Substance abuse among youth is a problem in San Juan County. That's the item for you to respond to.
We're still on opinions rather than facts,
Yes.
is that right?
Yeah.
Perception.
This is your opinion. Your perception, your view.
Depends on what substance.
We've got 42.
Okay, everybody give your answer one more firm press. See if we can pick up the other people.
So alcohol is part of this, right?
Yeah.
It is. Any kind of substance.
Milk.
How about Big Macs? Is that
How about big? Okay, so we're looking at 93% and 7% saying they disagree. Okay, thank you. Right, now we get a little more detailed. I think, so that's your personal thought, that the substance most abused by youth is, and this is in alphabetical order, alcohol, cocaine, heroin, inhalants, marijuana, meth, opiates, which are, even though heroin isn't opiates in this case would be pills, Vicodin, Oxycontin, and tobacco. Glasses on today. Everybody give it one more press. Okay, I'd like to take a couple of predictions.
What do you need?
Prediction on which substance do you think this group would say is the most abused by youth? Predictions. Okay, I'm hearing alcohol, tobacco, marijuana. Okay. I heard a lot of alcohol. alcohol. Anybody want to throw out a percentage in the room? How many people think that's the most abused? About 50%? Okay, there we go. Oh, 80% on alcohol. Marijuana 9% and tobacco 9%. It doesn't mean that there isn't abuse for the other areas, but it is interesting to see. Good for you is what I'm going to say, because alcohol is in fact the #1 most abused substance by our youth. Not only our youth here in San Juan County, but in the state, in the nation. And it still is the #1 killer. Okay, I'm going to turn this over to Court. And Boyd and Megan, if you want to have voice in this. We're now going to look at the data, the Healthy Youth Survey data, which drives the work that we do.
Okay, just one thing real quick. I'm distressed with the amount of food that's still over here, and cookies, and there's plenty of coffee and drinks, so everybody please continue to partake. Thank you.
And feel free to be able to get up and do that, and do it quietly.
I'm also distressed by this.
Louise, what would I do without you? Okay. I was principal of the elementary school from, moved here in 91, I was principal till 98. In 98 I moved to the middle school, was principal there till 05. Was involved in the beginning of the coalition and started giving what was called the Healthy Youth Survey. Almost every survey, not almost every state in the union, but almost every state gives a survey similar to the Healthy Youth Survey to try to gather information about the state of the student body in their physical and mental health and some of their healthy and unhealthy habits in order to inform decisions for the school district and for the communities. There's going to be a tension. The agenda says that this is going to be done at 11:50, and there's no way that that's going to happen. 12:50, and it's 12:43. It took about 45 minutes to make this presentation to the school district. For some of you, I may be going too long. For some, too quickly. I'm going to try to work through that tension and honor questions that I can, and still know that I have to move along before Cynthia gives me a boot here in the rear. We give it every other year to 6, 8, 10, and 12. And it's been given every year, as I said, since 2002. There are 4 different kinds of questions on it. She's already ahead of me. Okay. We have to.
I went back.
That's fine. There are 4 kinds of questions. I'm not going to read that slide. We know that our number, our N, if you're a statistician or you got a background in math, the N is very small. When you're only giving a survey to 50 or 60 kids, you have to be aware that you don't fall into a trap because numbers can spike up and down. But we now have data since 2002. The other thing as a principal I know is that in this community, and in every other community, classes, as they come into kindergarten, take on a character, as it were. And one group of kids that are 6 years old in 1998 can be very different and have a different set of characteristics than the year just after them. And some of you parents who had kids move through the system are aware of that situation. So we have to take that into concern too. We have pretty good, those are good, it's a voluntary survey, those are good participation rates, 3/4 pushing 90%, that's good. Next slide. What the coalition does, led by our statistician, who's Dr. Rita Weisbrod, who is a retired PhD, is we try to help the school district. The board doesn't have time to sit down and do all this, and neither does the administration. And we try to sit down together, analyze the data, and we make presentations to the school district based on what we find. Now these graphs, that's blown up as much as you can get it, right?
Yes.
They've got better eyes than I do if they can read that in the back. But let me give you an example. The other thing I want to talk about is the time lag. The survey, the 2014 survey was just given last month. It's given in October, and they're getting better, but we don't get the data back until late spring. Analysis happens in the summer, and it can really inform decisions in August and September for the following year. So that's the cycle we're on. When we looked at the 2010 data, we came up with something, and there are someplace between 150 and 200 questions is the way I remember it. It's a lot of questions. Questions are asked in different wording, the same kind. Same question will be asked 2 or 3 different ways, so that students that are making up answers and do not keep them consistent get thrown out in terms of the validity. So all those things that immediately come to mind are considered. When we looked at the data in 2010, we saw something, and I'm not sure how to do this because I don't have a pointer with me, that really concerns us. This is grade 8, and in the lighter green is 2010. In grade 8, 47%, virtually half of the students in 8th grade, reported that they had only received at most 1 prevention message in school, or reported having heard no prevention messages. Half the kids in 8th grade. In 10th grade, 3/4, 75% said they did not admit to or acknowledge hearing any prevention messages in school. And that was the #1 thing that we took to the school district that year. And the school district, Rick was there, pulled administrators together and worked to reduce that, said we have to do something with middle-level kids so that they get more messages. And when we looked at 2012, we discovered, now these are different kids, but we discovered that only 1 in 3, or 33 in 10 8th graders reported that they only received 1 or no messages. Is that kind of clear? I mean, it's kind of backwards, but in this case, the lower the number, the better the score. In 10th grade, it went down from 3/4 to 58%. And in 12th grade, in the high school, we had no effect at all. But the other thing, and I don't know that this was mentioned at all, but the original mandate of the coalition was grades 5 through 9. And we look at kids younger than that, we look at high school kids that are involved with that. The original mandate's grades 5 through 9.
Question.
Yes.
Where are they supposed to get this information from?
Oh, health classes.
School.
This is messages in school. Yes, this is messages in school. And there was a new health class introduced for 9th graders. There was a reinforced health class for 7th graders during that time, so that as a result of this data and analysis of it and working with the school district, those were put into effect. Yes?
How does this compare with what the school would report in terms of its delivery of messages? I mean, is it kids not getting the message or ignoring the message?
That's a good question. I don't know that we can actually answer that. The difference between I taught it and they learned it is the basic dilemma for all educators. But in this case, we feel like we were able in a significant way to impact that by making sure that we put more messages in front of them. Good question. Okay, more good news. In the 2012 survey, and these were general statements that all of us who were analyzing the data were able to agree. I'm not giving you backup graphs, but these were 2 things that came out. I often or almost always do my best in school, and my teachers notice when I do a good job and let me know. Those were very positive things in 2012. And 2 other things that happened between 2010 and 2012, kids reported they were more likely to get caught if they had drugs, alcohol, or weapons. I'm making a judgment, but basically we tend to think that's a good thing because one of the things that discourages people from making unhealthy decisions is the feeling that they're going to get caught if they do. There are others that we'll talk about as well. And the other thing is how easy it is to get something. And this was good news. Between 2010 and 2012, students overall in 6, 8, and 10 said, fewer students said it was easy or very easy to get alcohol, marijuana, or other drugs. So that from our perception in terms of protecting youth, is a good thing that it's harder, that it was harder to get those things. Okay. We're going to take a look at some specific graphs here. We're going to take a look, one of the things that we use is what's called 30-day use. Students who report that they have used a certain substance or something in the last 30 days. Let's start down at the bottom with the blue graph. Blue graph, that line going along the bottom between 1 and 8% or sixth graders. We would expect that, and certainly hope that, use by sixth graders was very low. And you can see that as you're going across the bottom axis is time. So there's nothing significant there at all. It's what we would expect. In 8th grade, which is the red graph, it goes up and down, but basically it's about 10 to 15%, and it is not in any sense trending up. 10th grade, 10th grade appears to be, I think Megan may speak to this later, but we tend to look at that time between 8th grade and 10th grade as the crucial time. Those 3 years are where lots and lots of things happen. And to me, that accounts for the fact that 10th grade goes up and down a lot. We are glad to see that from a high in 2008, where 4 out of 10 10th graders self-reported that they had a drink in the last 30 days, that it is now cut in half to 20% in 2012. Coalition members, or anybody else for that matter, if I put my foot too far in my mouth down the wrong path of interpreting the data, let me know, because that could well happen. 12th graders at the top, and this is, I think, was it 80% of us said that alcohol was the #1 drug, just in our little sort of survey we did. Well, in fact, 12th graders are pretty consistent between 40 and 50% of 12th graders report, this is self-reporting, that they had a drink in the last 30 days. Okay, let's go on. This slide, the other thing that we do is, I'm not going to spend a lot of time on this. This is a different way of looking at that data, and it just shows you that the higher up you go in grades, the more students use it. I don't want to spend any time on that.
I think that the only thing I'm going to say on the this is the graduating class of 2013. Right. So it shows 0 use of alcohol in 6th grade, 14%
right.
in 8th grade. So you can kind of see the individual
right.
class growth.
And that 51 and the 21 and the 13 are the same things that we just looked at on the graph the other way. Something that we're increasingly concerned about and that people in all communities are concerned about is binge drinking. We've read a lot about it on the national level at colleges, right? But it's also an issue in high school. And what this says is that the binge drinking question is not asked of 6th graders. So we got data here for 8, 10, and 12. But 8th grade data, you can see that, and we had a problem, 8th graders did not take the test in 2006. But someplace between 1 in 20 and 1 in 10 8th graders said that this questionnaire is given the second or third week in October. It does not, we've tried to see, is it related to homecoming? We've tried to look, and we really don't think it is. It's just the way they're reporting what happens. You can see that 10th grade class, those spikes go up and down, and if you remember a couple slides back, there was also a 10th grade class that was doing exactly the same thing on 30-day use. Here those students are reflected in as going down from a high. However, there's a pretty steady, when I look at this data, the one chart that says that we're going in one direction is the 12th grade. And that line across the top, the blue line, went from between 20 and 25% reported binge drinking in the last 2 weeks to between 35 and 40. So to us, that is pretty significant. Yes?
This isn't the percentage of the students filling out the questionnaire who have participated in binge drinking. This is that they have observed it or know it's
No,
happening.
this is a self-report of the student.
Of the individual who says
Right.
they've engaged in that.
Yes, and that we remember is of the entire class, then the subset of those who actually participated in the survey, and then there's a smaller subset that I don't have for you, but not too bad, because most people who decide to take part in the survey also try to do it honestly. But then there are a few that are sliced because they get caught not being consistent. Okay, cigarette use. One of the things that educators felt very good about for years was that cigarette use was going down. There was a big settlement, as we remember. Millions and millions of dollars were poured out of that settlement into education, the county health department, money coming into school districts. And the only thing I'd like to point out here is that we now have, that if you look at just the 2010 to 2002, they were going steadily down from 2002 to 2008. And now there are some spikes that are troubling. I'll be honest, all the money is gone. There is no more tobacco settlement money to impact the advertising of corporations. So, but almost 3 in 10 10th graders report smoking regular. We call 30-day use regular use. Okay?
Oops.
Tobacco. Oh, wait a second. Okay, let's go on. We know that's. I want to skip that slide too, just for time. Okay, there's only one thing I want to really. This is comparing the state and the school district. One of the things that we look at is how our students report versus how students across the state report. And one of the real interesting things that is happening is in 12th grade, this is electronic cigarettes, this is e-cigarettes. This was an issue that did not exist 7, 8 years ago. 1 in 4 of Friday Harbor 10th graders report having used an electronic cigarette in the last 30 days. Tobacco that tastes like candy, fruit, or alcohols. 1 in 3, 37% of our 12th graders. Those figures, this one is 3.5 times the state, and this one is better than double the state. This is the state average. 16% of seniors across the state report using it, and 37 of ours. 7%, 26%. Cigars, cigarillos, little cigars, once again, we are double the state average, and that trend is true in, not necessarily double, but in every case, San Juan Island's 10th and 12th graders are higher in terms of tobacco use. We don't know if that's going to continue, although those new categories are the highest categories. They're even higher than cigarette use. So that's something to put in the hopper as we look and think about these things. Boyd, are you going to do all the marijuana together at the end? So let's skip to marijuana. I said earlier that one of the things that determines whether or not youth use or make an unhealthy choice and use a substance is whether or not they feel like they're going to get caught. Another real important determinant, and they report this themselves, I'm not making this up, is how do my parents feel about it? Or how do adults in the community feel about it? And for all the talk that kids do about trashing parents and adults, they actually listen to and talk about what we say a lot. And what we say makes a difference. And this slide talks about the, let me catch up with myself here. This talks about how they perceive their parents being disapproving of their use of a substance. And so let me try to say here, in 10th grade in 2010, 93% of the students in grade 10 said, my parents disapprove of me drinking. Are we together? Do you see what that graph is all about? Whereas in 10th grade in 2012, that was down to about 7, I'm guessing that was a 77 number right there. The important thing here is, and I bet you recognize the same thing, that in every case, for every substance, for every grade, the students' reported perception of their parents' disapproval, whether it's alcohol, cigarettes, or marijuana, their perception of that disapproval went down. And to us, that is a risk factor because they are not perceiving. Doesn't mean their parents actually feel any differently about it, but they feel like their parents are not as disapproving for all three categories: alcohol, tobacco, and marijuana. Yes, Tom?
Do you have any data on the parents' use of these substances?
We do not. We do not.
That might be a factor.
Oh,
It's a total
I think it's absolutely a fact. I would guess that it is a factor, yes.
This may say speak to this.
I'm sorry?
This perception of adult disapproval in general may address that.
Well, yeah. The last graph spoke to their just their parents' use, and obviously students have two circles of adult influence. They have their parents as the one closest to them, and then they have adults in the community. And if we look at this, for example, in 12th grade, 12th graders reported in 2012 that only 8% of adults in the community felt it was wrong for high school seniors to drink. Only 8%. That was down from 2010. Now once again, that was different kids. It was a different group of kids. But in 2010, 37% of 12th graders reported that the adults in their community felt it was wrong to drink. Now, what happened in between 2010 and 2012? 502. Instead of walking into one store on the island, 1183. 1183, thank you. I invited everybody, I knew that. If that's the worst I do, I'll be all set. You walk into the hardware store, and in order to buy a plumbing fixture, you walk by the alcohol. And it's all over. Clearly, there are differences in adult attitudes, and our concern really isn't the adult attitude, it's the effect that that adult attitude has on students and youth. And when my point in these both two graphs, there's a real close relationship between how they perceive their parents' feeling and how they perceive adults' feeling. Okay, we're comparing how. Okay, we just looked at how San Juan Island students perceive adult disapproval. Now we're comparing San Juan Island students with the state average. Statewide, 12th graders in 2012, statewide, 8% reported that they felt the adults in their community were against them drinking. No?
No, that's local.
Oh, it's at San Juan, excuse me, right. 29%, absolutely. 29% is statewide, 8% was San Juan Island. 39%, this is cigarettes, 39% reported statewide that adults disapproved of their smoking, and in San Juan Island is 21. And in use of marijuana, 40%, 4 in 10 students reported that the adults in their community felt it was not right for them to use marijuana. In our 12th grade class, it was 4%. So we're looking at that relationship. And now, far out. Yes?
Okay.
The
trend in both cases, whether it's the state or local, is for the percentage to go down from 8 to 10 to 12.
Absolutely.
So there's a consistency in terms of the trend, but obviously the absolute values are much higher here in our county. But the trend or excuse me, the decline with age, couldn't that just be accounted for something as simple as the younger the child is more likely to pay attention to their parent, and they get older and get to be teenagers, they're much more dismissive and say, oh, my parents don't care, or something to that effect.
I think that's a major factor, sure. Okay, now I'm going to turn it over to Megan, who's going to talk about, she's on the front lines working in the middle school and high school, and she's going to talk about the challenges that we face as a result of the data and what we're doing about it.
All right, thank you, Court. So I'm going to just basically sum up what you've just heard, the challenges that our community faces here in San Juan Island and in San Juan County. We need to change the trend of the 30-day use overall, the alcohol, tobacco, marijuana. We want to reduce that. We want to see a decrease in use overall. We have some serious concerns over binge drinking. You saw those numbers, especially in the 12th grade group. It's scary. I mean, binge drinking leads to alcohol poisoning, could lead to death, could lead to addiction. I mean, binge drinking is just incredibly unhealthy. We don't want our kids to be doing it. The new popular delivery systems for nicotine. We're talking about those e-cigarettes. We're talking about all those new devices that if you haven't seen or you haven't heard of, I really encourage you to go next time you're at the big store, the little store, or any market, look and see what's available to kids now. There's a lot of changes that have happened in nicotine use in the last few years, and it's good for you to be aware of what's out there. A lot of parents have no clue what this device is in their kids' backpack that they have. So, and then addressing the dramatic jump from 8th to 10th grade. If you saw, of course, like some of you mentioned, of course we're going to see an increase of use as kids get older, but we see that really dramatic jump from 8th to 10th grade. So that's something we want to address. Next slide, please. And I am going to talk about ways that we are addressing these things, just so you know. Some more challenges, the perceptions of adult attitudes. That's something I need help with. You know, if you're here from the community, that's something that we can all be doing a better job of. I know that since I've been in this position, I've become way more aware of the conversations that adults have when kids are around and what kind of messages we're sending to kids, whether we mean to or not. When we're sitting at the dinner table or out to eat or hanging out with our friends and we're just having loose conversations about different things and thinking that they're not paying attention when obviously they are listening. So yeah, concerns over falling perceptions of parental disapproval rates. That number, that 4, I can never get those two numbers out of my head, that only 4% of our seniors in 2012, that's last year's seniors, thought, or the year before, thought that it wasn't okay for them to use, that their parents would disapprove of them using marijuana, and only 8% thought their parents would disapprove, or the community would disapprove of them using alcohol. Those are adult perceptions, not parent perceptions. So that's us as a community, what we can be doing a better job of. And then rise in community acceptance rates for marijuana use, the impact of I-502. I will tell you, I see this in my job. I can't give you statistics, but I'm predicting that we will see an increase in marijuana use with kids because it's just a lot easier to get now. I mean, a lot more parents have it. Kids know where to go. I imagine it's going to get more accessible like we see in alcohol, where parents get it, they keep it somewhere that's easy for kids to get. And they hear people talking about it. You know, parents are talking about marijuana. In past years, maybe they weren't talking about it. And, you know, for us in the coalition, the discussion isn't so much about adults. It's really about protecting our kids. So what we're doing, I don't think there's a slide on what we're doing. So can you go back to the last one? Okay, responses to challenges. So I'm going to talk about some of the things that I do and that we do as a community and as a coalition. Court talked a little bit about our health classes. I'm now in the 6th grade health classes, 7th grade health classes, and 9th grade health classes. I see every kid in health class for 6 to 8 sessions. So I'm in there a lot, giving prevention messages. I work with our clubs in the middle school and the high school, doing various prevention activities, and increasing awareness of the issues, but also raising awareness of all the kids who aren't using. How many of you have teenagers in our community? Okay, so you might hear them say, everybody's high all the time, everybody's drunk all the time, or everybody uses, and that isn't correct. You know, when you look at the data, you see really most kids aren't using. And so that's a big part of what I do working with these youth, is recognizing that a lot of kids are doing the right thing, and they can too. They're not alone in making healthy choices for themselves. In the community, I mean, the coalition is a great place where people come together and meet, and we all do our own parts in the community to spread prevention messages and help to do various intervention methods with community members and with our young people. I know there's so much more I could say, but I'm losing my train of thought here. So my position in the school, this is my 2nd year that I've been in the school district. I'm very busy, and kids come to me a lot, so I can see that it's needed in our community. And kids really want to know. They have great questions. Yeah?
Do athletic teams in the San Juan schools require kids to do any kind of contract that they won't drink or...
Yeah, the whole state requires that for kids. It's the co-curricular policy. So every kid she asked about co-curricular policy, which is something students sign if they're in a club, a sport, any sort of co-curricular activity, that they agree to keep their grades up, they agree that they won't be, not only will they not use drugs and alcohol, but they're not allowed to be around drugs and alcohol. So yeah, we do have that. Yeah. Yeah, Sam?
Megan, I was always concerned about the kids that, you know, they struggle to have their grades up. Now they can't even get on the sports team.
Mm-hmm.
And so they're kind of left off, you know, to be smoking.
Mm-hmm.
You know, and I always thought that was always an issue.
Yeah, it's definitely a struggle with co-curricular, with anything. You know, it's this fine balance of we want to use it as a prevention tool to keep kids away from it, an incentive of like, I can't go to the party, I'm on the co-curricular policy, I won't be able to play sports, or I have to keep my grades up. But then if they break it, then they lose that, or so the best thing I can say is we just have to really work with those kids and support them and help them get back on track. And luckily we do have some great resources in our community when they can be taken advantage of. I'm here, we have Compass Health, we have great therapists to work with kids. We have supportive staff who are willing to stay after school and help kids. It's just kind of getting them motivated. But there's great support for those kids, and they need it, as you know. They need those extracurricular things. So, any other questions? Yeah?
The communication I've heard of so far is all between the coalition and other people,
Mm-hmm.
and the kids through the school. What about directly to the parents? How is that communication? Is there any of that? And how
there
effective
is, but I'll tell you, it's a challenge to get messages to parents. Parents are really busy, and like last year I offered a workshop for 8th grade parents on, a lot of it was information on what our statistics were, but then how to use prevention methods with their kids that would, proven prevention methods. And I think 4 came to the one that I gave, and I called a bunch of parents personally. And so people are busy, and that's something that I need your help with. I need everybody's help with, is getting those messages to parents. So.
And also over the last decade, working with the Family Resource Center with Joyce Sobel, we have done several parent education classes, either through directly through the Family Resource Center, their own, but we have brought in parent coaching professionals, Gloria DiCayetano, Laura Kastner from Seattle. So we have provided parent skill development and education over time, and it's one of those things like once you do it, doesn't mean you're done. We just have to keep doing it over. The problem is often once a parent goes to one, they don't come back, or they don't commit to a series, or they're embarrassed to come. So we still find a lot of barriers in the parent education, but we're not giving up. It's definitely one of those components.
I'm always trying to think of better ways to reach parents and work with parents. And my job's kind of tricky because when I work with students individually, it's confidential, so I can't just call up a parent and tell them about what their kid's telling me specifically. But I know I could be doing a better job of it, and I know I'm always working towards that, is reaching those parents and getting the message out there. Yeah,
Well,
I see one, yeah.
There's a lot of things that go on in this building that are not state funded that attend this.
And since Joe said something, the Presbyterian Church also works with parents and families. So many of our organizations help to build the skills for families. Thank you, Megan. Yeah, we can do more questions at the end as well.
Thank you, Megan. I'm Boyd Pratt, and I'm going to be reiterating some of the things that we've already looked at in terms of marijuana, and looking at it a little more closely. But I do want to say that Megan's doing an incredible job in the schools, and also in addressing the parent issue and getting the parents' attention. We are trying a public awareness campaign in terms of sending out letters to parents of school-age kids to talk about marijuana and try to give some basic facts in regard to use and the effects of the use of marijuana on students. So, what I'm going to look at are several factors in regard to marijuana in terms of this health use survey. And in looking at it as a group, we came to several conclusions kind of right off fairly soon. One is that, as you've all seen, that use really begins between the fall of the 8th grade and the 10th grade. So there's really a big jump there, and you'll see that in terms of the graphs themselves. One encouraging aspect of it is that since 2007, 8th grade use has actually fallen, is either at or fallen below the state average. And so that's very encouraging, and we think that may in turn have been related to some of the programs that were actually in the school in terms of healthy living. There is a consistently, kind of across the board, higher use in the 10th and 12th grades compared to the state average. This is really kind of a surprise to me, but 1 in 4, 25% of seniors regularly use marijuana, and I'll show you that factor, and I'll explain what I mean by regularly. And then finally, that our heavy use in terms of the seniors again is significantly higher than the state average. So, okay, next slide. So I think you've seen this before, but basically in our perception, the higher numbers are the worst numbers, and the lower numbers are the better numbers. As you can see, the two lower ones, the blue and the red lines at the base, are the 8th and the 6th and 8th grades. So really, there's that big jump between 8th and 10th grade. It's basically looking at that gap. Okay, next slide. So in this thing, we're comparing our students here with the state. So our students are the green ones to the left of the column, and the state is the orange or reddish ones to the right. And it goes through years, so 2007, 2009, 11, 13, 15, and 17 in terms of the class cohorts, when they're going to graduate. Okay, and so that what you see here is in the 8th grades. In fact, these are all very low figures. And one of the things I want to point out is in terms of use. So the basic question is, how often have you used marijuana in the last 30 days? And these various colors are graded according to their answers. So these really, the good news is that all this stuff above the darker shades is no use. And so in fact, most kids are not using it. And that's great news. But what you then they break down the answers between 1 to 2 days, 3 to 5 days, which we combined here, and then getting into these darker shades of 6 to 9 days and 10 plus days. And so we kind of assigned a regular use category to the 6 to 9 days and the 10 plus days. So basically, these two darker shades down here, we're figuring if they're using marijuana, 6 days or more a month, that's regular use. Okay, next slide. So 8th grade, we're not worrying about it too much. 10th grade, we begin to worry about it, and we see that in terms of the cohorts, that in fact, that in recent years, it's gotten, in recent years, it's gotten better, but still compared to the state, there's consistently more use locally than the state averages. Okay, next slide. And that is particularly of concern to us in regard to this particular latest trend. So, as I said, those two darker shades combined together constitute regular use. And that is almost 25% in this last cohort. So
it's 35.3. It got cut off, 35%.
35? Well, that's overall use.
Oh, okay, sorry.
I'm sorry, overall use
Yes.
once in 30 days at least was 35. But here in terms of regular use, it's down, it's 1 in 4. So that's really of concern. Okay, next slide. So again, you remember we did this, we asked the students about use every, how often have you used in the last 30 days, and then we asked about the parental disapproval, and then we asked about the adult disapproval. And so this is the parental disapproval. Again, you've seen this before in regard to alcohol, cigarettes, and marijuana. And again, comparing that change from 2010 when it was taken to 2012, and that fall off in terms of the actual perceived parental disapproval. In our view, in terms of the coalition, the higher numbers here, the better. So to see that fall is really quite anxiety-producing. And in particular, this one, again, of the perceived adult disapproval. And I want to reiterate this. We're not talking about, adults using and things like that. We're not judging that. What we're judging is their disapproval of students' use. And you see it in terms of marijuana, it going down from about 25% down to 4%. And again, in alcohol going from about 37% to 8% from 2010 to 2012. And next slide. And so again, you can see this in regard to, as it flows through time, this chart is almost a reversal in terms of use, because again, the higher percentage, we like the higher percentage, and that's for the 6th and the 8th way at the top there, where there's a high perceived adult disapproval of student use, as opposed to that fall, particularly in terms of the seniors in 2012 at the very bottom there. Okay, next slide. And in particular, when we compare it with the state statistics, that's what's really amazing. So again, the San Juan Island School District is on the left of these columns. The state is the darker orange color on the right. And when you compare the alcohol and the marijuana one, you have 8% local versus state, 29%. And then marijuana in particular, only 4% adult disapproval as opposed to the state of 40%. So this is really quite a major difference that way. Okay. And I think we're on to you. Is that correct?
I think we are. I think we're going to, we've done all of this.
Any questions about that? We warn you all out.
Well, I'm going to say put your questions on the table. What we'd like to do is have the opportunity for folks to chat. Now that you've been given some facts, some background about the coalition work, and some notion of perceptions, whether they're your own youth's perception of what they think we're thinking as adults. We'd like to have you spend a little time talking at your table. There is chart paper and pens in the middle. And we're going to say, in consideration of the passing of two significant environmental issues, that being in November 2011, the state of Washington, at about 54% of the population in San Juan was consistent with that, was the deregulation, what we call the privatization of liquor sales, meaning now it wasn't just controlled by state liquor stores, but now there is liquor sold in a variety of stores, including Ace Hardware. So in the prevention field, when there's a higher density of sale accessibility, that's typically increased access for adults, is also increased access for youth. So that happened in 2011, went into effect in 2012. We're seeing statewide increased use among our youth. Initiative 502, the legalization of recreational marijuana use, also will increase access by having marijuana stores. So what's the impact on youth? So now we're going to kind of rein it in and say, and I'm going to say, because you're the League of Women Voters, you do have voice on policy. The coalition has the opportunity as an organization or as individuals to have a voice on policy legislation. Policy can be, we call little p, may not be legislation, could be policies in the community, policies in a home, policies in a school, up to big P policies, which could be local ordinances, state laws, federal laws. So given these two increased accessibility legislations, what is the impact on youth? And have a little chat at your table based on facts and what you see might be happening in the future. What's your thoughts? We're going to ask each table to record and decide 1 or 2 points to share out in about 10 minutes. So you'll need a recorder. I'll give you a 8-minute warning. I'll kind of be going around. If I don't see anything written down, I'll remind you to at least get down 1 or 2 thoughts with the notion you'll share 1 or 2 others. And write it on your charts. Yes. The information we didn't have.
We always never are on time with our agenda because we always generate so much really cool discussion, and we are running about 20 minutes late. So what we're going to do in just a few minutes is I'm going to ask each table to present. So if you have a spokesman from a table to present, and we will give our attention to each table as they go. That'll probably take us right up to 2 o'clock. So before we do that, if you brought a salad today, or if you brought cookies today, or anything else, thank you so much. And everybody, thank you for bringing all the food. As you're leaving, if you want to grab something as you're going, that would be great too. Also, I do want to say thank you for how this happened to become, and for the commingling of this group to be able to participate today. So thank you very much for everybody that came and participated. So that being said, we're going to start off with this table. So if I can get everybody attention to this front table as far as their spokesperson on what they talked about.
Make Susie do it.
Okay, well, we in terms of the adult perception and the kids' perception of what adults think about it, we think it's very important to make the distinction between what is legal and what is okay for kids. And like to some extent, I mean, it's been made in other products. With tobacco, I think that message is in fact there. I mean, a lot of yes, tobacco is legal, but everybody has finally, or most people have now internalized the message that it's bad for your health. We raised the question of how to find and use effective measures to get through to the children, to the youth, and one of our members suggested that a good deterrent and a good tactic would be to arrest people and really force them to feel the weight of societal disapproval in that way.
Increase law enforcement. Okay, thank you. Table. Let's move to this table right here. Who's the spokesperson? Mr. Pratt?
I was writing anyway. Our principal question was, what can San Juan County, and particularly the county council, do about the risk of what was termed confectionery marijuana products, and that is stuff beyond brownies, popsicles and all sorts of stuff in the San Juan Islands, particularly among the younger children, so that by falling accidentally into the hands of younger children and hurting them. We also had a fairly robust discussion about the data and its interpretation and whether we ought to be truly concentrating on marijuana as opposed to other drugs. So.
All right, thank you. How about this table that I'm near to now?
Joyce is speaking for us.
No, you broke. I think that, you know, it was agreed here that the perception of if it's legal, access will undoubtedly increase, both on the part of youth and adults. But then the question came up about the As I See It column that was in the paper this week, about the mother of a 9th grader, I believe she was, who somehow procured marijuana at school, according to the article. And the mother brought up the issue of drug testing for students. And we don't know anything about drug testing. Wondered what the rules around it were. Is it legal? Is it not? You know, is it by state? Or is it really true that teachers experience or go through drug testing? And if so, how does that occur? So just a whole nother area to look into at some point with lots of questions.
All right. Are you tabled by yourself or are you with that group? Okay, let's check it. You won't leave anybody out. Who's presenting for this table?
I will hold this up, have Brad hold it up. It's a mouthful.
This one wins the award for
artistic.
Okay, so under I-502, there was a lot of discussion in our group, so we just put a few things down. There's a lot more we talked about, but we're in need of more county regulation or clarification. People had different thoughts on that, but the regulations sound like, regardless, need to be discussed more. The health and welfare of our community is a huge concern. Crime concerns for grow operations or how that might change in our community. Attractive nuisance, which, can somebody describe what that was? What that attractive nuisance? Oh, the crop itself. Right, that's right. So having the crop can attract nuisance here on our island, or more crime, or issues that might come about here. And then I-1183, the increase of accessibility, just kids seeing it more often, being more available. As a culture, you know, how we view alcohol as a culture, we have it at every event that we have, not every event, but many, many events, and it's seen as a big money maker. So people, you know, if they're trying to do a fundraiser, think, let's get alcohol there. It'll be the big money maker. Social norms, having unhealthy social norms and how that's impacting our youth. And then lastly, the dangers associated with binge drinking, of course, is a huge problem. So,
How about you guys?
So we started out talking about why do we have so many kids using marijuana if you're higher than the state average, and then we talked about how our vote was much higher than the state average to legalize marijuana, and so having that direct correlation between adult approval and kids' use, adult use and so we talked about why that sort of came about. And then we talked about the ACE issue and alcohol visibility here with the other I-502, and was that 11th grade? And, you know, what was great about this group is they were like, hey, we need to change community, we need to put community pressure on these businesses here, not only through town council or county council, but when we walk into ACE, what if all of us went into ACE and said, I don't like that your alcohol is right out there on the first row, available to whoever walks through here. There's no limitations on that. If we all went in and said we didn't like it and we're customers, that would put pressure on the business.
Let's walk there right now.
And then the little locked cabinets at King's, well, we had an impact on King's because they put little locked cabinets. Those are, and someone pointed out, they're very often unlocked and open. And so when she goes in, what's your name? When Ann goes in, she always says, will you please lock those cabinets so that kids can't steal alcohol here. So I think that's great. I love the idea of instant impact. We always try and change policy, but doing it from the ground up is what has the most impact, like the cigarettes. And why are cigarettes in a cabinet? I mean, why are they behind the counter and they're hidden away? Cigarettes are not able to be stolen right now, but alcohol is. So shouldn't they do the same?
Did any of the other tables talk about the ACE, about the alcohol dinner?
Well, the only thing you can say about that is I think it is probably advantageous to have it in a location close to the visual sight of the people who are working. And if you look at it that way, it could be in the far corner on the left, which is still really close to where the cashiers are, but isn't in the front aisle. But that is another factor, is under eyes.
Level.
So the one other thing we talked about was we were curious if there were issues with alcohol theft at these stores, and if there was any requirement to report that, and then if that had any bearing on how they, police their alcohol displays and make sure that there isn't theft going on. So we didn't, that's a question. Do stores have to report what they lose in their inventory through shoplifting? And then do they have to do anything about it if there's a trend, where that is an issue?
So yes, that is a state liquor control board policy, is that all stores are required to report theft. And then there's a tier of responsibilities and actions if there's an increase in theft. And again, that's going to be, the stores are self-reporting their own theft. So that's...
I'm pretty sure after the first year, the Kings did report that did you have actual statistics?
Yeah, 4 incidences.
Yeah.
Between the two stores.
4 incidences of potential alcohol theft or shoplifting or missing bottles, shall we say. I have a question.
I believe that either the owner or the manager of ACE has young boys. And I would think that would...
Donnie Jr.? Daughter and son, I think. Yeah.
There's an affordability issue with alcohol too. I'm involved with a litter cleanup group, and frequently we find on the side of the road those very small plastic containers. They call shooters. And to the extent that those are made available and are right out front for kids to see, those are incredibly attractive and an affordable means of buying.
That's what we have them put in locked cabinets.
Lady from Lopez?
Beverly, that's her. She's looking around for something that bothered me, and that was the fact that as the youngsters got older, they are more prone to drink. But then we stop at the 12th grade, and they go off to school, or they go to work, or they're out from under their parents' supervision. We need to treat that group, 19, 20, 21. I think that's really important.
Absolutely, and just to let you know, on the forefront right now is the federal government has given our state funding to do a better job at looking at that age 18 through 25 population. So we're calling that the kind of the healthy youth or healthy adult initiative. So more to come on that. Being that we don't have a university here, we're not necessarily feeling the impact. But the coalition's goals, one was to talk to Dr. Rita Weisbro. Her thing is we want our kids to have the skills before they leave the island, so they're responsible decision makers when they're at university and on their own, but we're not seeing that. So yes, there is definitely an agreement and an effort to do that it isn't just about the youth, that we really have to be looking at the young adult behaviors as well.
Tom?
Why don't everyone who never uses alcohol raise their hand?
Since when?
Say in the last year.
Never in your life? I mean,
last year.
What's the purpose of this
question?
The purpose is, why are the ones that didn't raise their hand using alcohol?
Because I like wine with my dinner.
Yeah?
Yeah, I second it.
And your point, Tom?
It's bad for your kids. Yes, it is.
But we are adults.
And you can do what you damn well please, right?
We can make a decision about the degree to which we risk our health.
Yeah, well, the kids feel that way too, I'm afraid.
David?
Do we have statistics on our prosecuting attorneys, arrests and court outcomes to compare to other jurisdictions? Are we doing a good job of deterrence to the extent that you can deter by harsh penalties, convictions and harsh penalties, opposed to taking just a laissez-faire approach to convictions?
We can provide statistics on our county as far as arrests and or convictions or diversions for things like MIP, DUI, alcohol or drug-related arrests. I don't have statistics to compare it to other places, but we have information about what happens here.
MIP?
Minor in possession is the, sorry, it's just a short.
So are we any more lenient towards abuse through the court system than other jurisdictions? Do we know that?
I don't know that.
Yeah.
I just know what happens here.
I mean, if we are less strict on that gives an incentive, or at least there's no deterrent, or lesser deterrent.
The law enforcement has generally been, as far as the sheriff's office, it's always generally been fairly harsh on arrests. There should not be any kind of, they take an oath and they're mandated. If there is somebody under the age of 21 and they're in possession of alcohol, they should be arrested. Now, after somebody is arrested, what happens then? They have to go in front of a judge, they have to go in front of a court, and any number of things can happen at that point, whether it's a diversion program or a conviction with penalties. If they do a diversion program, do they have to do proactive things to get there? You have a juvenile court for anybody that's under the age of 18. You have a district court for anybody that is 18, 19, or 20. Superior court would handle felony, drug and alcohol related matters, whether you're young or old. So once again, to compare to other places, I don't know where we are at that, but I do want to say, at least from my standpoint, I think that law enforcement and the courts take it very seriously once it gets to us. Would much rather it not get to us, but when it does, that's what we try. Question or comment?
Well, I was going to say, going back to the trash, if there's a chance, our 9th grader had thought about this last year, but quite frankly, we haven't done anything with it. But we do a little bit of the trash pickup in our small neighborhood, but for those that do the bigger roads, if you're willing to take a photograph of the whole shebang showing...
We did that once.
Well, we would love to see that data, actually, where we could look at how much of it is alcohol bottles and then other trash. And that's something we could work on as a coalition where the youth can get more involved with that. So I'm putting that out to anybody that's on that pickup for trash. Yeah, thank you.
All right, everybody, it is 1:58. We got one more of these questions. It's up on the board, so everybody grab
we got rid of
a thingy. We refer to these as response cards. Everybody grab their response card. We'll bring it up big.
Supposed to write this on. Write what?
We'll leave it there then. There's no numbers on these.
Wait, it'll just take a second. I had to reset it.
Okay. Okay. To use this? Is enforcement number one?
Okay. Oh, yes, sorry, the number went away.
All right, everybody, in your opinion, what is the most important issue concerning the legalization of recreational marijuana in San Juan County? Enforcement is number one. Growth and production is number two. Products such as edibles, beverages, etc. is number three. Sales is number four. And underage use is number five.
Alphabetical order.
Alphabetical order. Not trying to influence. We probably have about 30-something people in the room right now.
So repress everyone if you could, in case it didn't pick up.
1, 2, 3, 4, 5. All right, we got about 24 responses. Let's see what it looks like.
Thank you.
By a very clear, high margin, everybody in this room seems to be most concerned about underage use. And I think that's certainly the message that we wanted to get across today. You may have already been there before you came. Once again, on behalf of the San Juan Island Prevention Coalition, and if I can speak for the League of Women's Voters right now, thank you all for participating today. We like to honor the 2 o'clock time, so officially we're going to end the meeting. But if anybody has questions or they want to talk, a few of us are going to be around. We're going to be cleaning up and putting stuff away, so if anybody wants to participate in that, that would be awesome as well. Otherwise, thank you everybody for being here today.